But I like that bond. That bond was, it was like no other. And my baby, when she would breastfeed, she would always put her hand on my chest. So just having that connection, that warm feeling with my baby. Hi, my name is Jaqueline Bermudez. I'm one of the breastfeeding peer counselors at the Gaithersburg clinic. I'm a first-time mother myself. I had my baby last year, 2021. So my baby is currently 9 months, about to be 10 months. So with my experience, I definitely loved it. I definitely loved the bonding that I had with my baby. Also, just learning what worked best for me. Now about the decision, how I got into going ahead and being determined to breastfeeding was the WIC program. Taking the class, they informed me, they gave me more information about breastfeeding, the benefits about it, what happens if you do not breastfeed, how it's very good for the baby. So I tried my best. What I enjoyed about breastfeeding was the connection and the bond with my baby, especially when she was breastfeeding from the breast. Now I'm currently only breastfeeding, I'm pumping. She weaned off the breast, unfortunately, but I'm still breastfeeding with pumping. But I like that bond. That bond was, it was like no other. And my baby, when she would breastfeed, she would always put her hand on my chest. So just having that connection, that warm feeling with my baby was something I very much love. The hardest part with my breastfeeding journey was in the beginning, just because in the beginning, I didn't know, like this was my first time. I have plenty of brothers and sisters, so I always see my mom, how it was so easy for her. Now with me in the hospital, I let the nurses, the doctors know what I wanted as how WIC explained it to me, and I did exactly how they told me, how they recommended, which worked. Anything you say, they do help you, they do understand, and they go with that. So now when I had the baby, I definitely went automatically breastfeeding, but I wasn't producing much milk, so that was definitely very concerning, and especially when the baby's crying. And then this was very new for me. I didn't know what I had to do as a mother, and my baby also had jaundice when she came out, that from what the doctor had told me. I didn't know. Now I know that there's other methods that I can help with the jaundice, but what doctors go ahead and recommend is formula, and that's something that I honestly didn't want to do. So that definitely had me feeling less about myself as a woman, as a mother, just because I wasn't able to produce enough milk for my baby to help that jaundice level go down. So that's something that I definitely was difficult for me in the beginning, the first 4 weeks. But the consistency is what helped me, not giving up. That's honestly what helped me and helped me overcome that, and just telling everyone that was supporting me, my family and friends, that this is what I want to do, and they respected it. One advice that I would give to a mom is just to have patience with yourself. From what I learned, you don't get it at the first try, you don't get it at the second, you don't get it at the third. It's gonna take multiple tries. It's like a trial and error. You're gonna know what works best for you. Other moms are different. They might have a perfect experience with their breastfeeding, but everyone's different, and you're always gonna end up accomplishing what your goals at all times. And especially having that giving yourself positive energy, talking to yourself nice as well, that you're going to be able to do it, is something that I advise all mommies, just because I know it's not easy. It's not easy the first few weeks, especially that you're not getting much sleep, but it's something that you can accomplish for sure.